you stated that there are two ways where you will be successful in another initiative. But it sounds actually very, very simple. How are you going to realize simpler protocols, for example?
We are not, the simplicity point is mainly looking at it from the market point of view. I've kept some slides. I mean, I have some slides for the question. I'm not going to flip until we have questions related to them. When it comes to simplicity, it's about the market. What is quite obvious in many developing countries, no one cares about legislation. So it gives us the freedom that is not available in the developed countries where the legislation is quite tight, and that's where protocol is going to help us, and that's where simplicity of protocol applies.
What is it exactly that it does? Because I'm not sure that personally I follow it. So you bring relatives in contact with medical practitioners? Is it a platform where you bring them into contact? Through a mobile phone?
Well said. The platform brings patients. We need the patients needing care. Yeah. We need the healthcare provider, being a medical. The critical piece we bring in between is other relatives so that they can support financially, making sure those two people support each other. So we don't want to rely on aid, on help coming from developed countries. We don't want to tap into that power that exists over there, but also over here. There are millions of people in the diaspora pushing a lot of money over there. How can we make sure that it's used properly and used for what is critical being had?
So is this platform already developed, or is it an idea?
We've done the first phase, the visibility phase I've mentioned now, and what we call the resource and education phase, where medical professionals can subscribe. Meaning, if I go to Cameroon on vacation, where I'm sitting, I can view who are the doctors around me and contact them. We're also organizing quite some webinars in order to educate them on latest evolution, and we are trying to connect with universities here, University of Leiden, Amsterdam, and there's a third one we're talking to, in order to share knowledge, research and development knowledge, but also making sure that they can be part of providing webinars once in a while.
How do you ensure quality? I mean, whoever could actually subscribe, I'm a medical doctor, I'm experienced, and I'm part of the platform.
So what we've done at that level, we do have a legal person in the team taking care of that, but the simple process we've put in place, because we're focusing on medical professionals, is working with the different Ministry of Health, making sure that we have a list with what they call the registration, the medical code of every medical person. So when they subscribe, we can match it and cross-check before validating that they can be part of the platform.
Who are your partners in this? I saw that you've gone live with the website. Who's helping you to finance it or to get this further? How does that work?
At this stage, it's all coming from my saving account, because I'm really believing into this project, and part of the purpose of being here, of course, it's not about the money, but it's about the influence, getting the right influence in order to push it through and make it happen.
I'm still trying to understand. So in practice, so I'm ill, I call the platform and I know where the doctor is.
Explaining simply what I call the 5 points of the services we provide. Web-based, where we hope to collect mobile technology, simple mobile, to tap into the database.
Handheld, it's not on mobile phones, but it's on handheld.
It's handheld, first step. Visibility of medical professionals is one of the services.
You know where they are.
Exactly, and who they are and what their specialties is. Second of all, educating these medical professionals as far as we can go by providing them written information, vocal information with webinars.
About what are you educating about? The
medical topics.
In general?
In general. So we will pick different topics from here, there, South-South collaboration, North-South collaboration. Third topic, we bring in the healthcare seekers, being able to make an appointment with medical professional online. Fourth topic, payment system. And that's where the relatives come in place, supporting the guys that either think the money should be used for something else and help in making sure that the payment. And the fifth element is online consultation, because we know 2 medical professionals, 10,000 healthcare seekers. If we do not stimulate some kind of, the connection will be difficult.
It's not totally clear for me.
Okay.
Last question?
Yeah, your target market is actually the non to low educated people, Because I would assume that the rest, they know where to find a hospital and they understand how to talk to a doctor, or maybe. But these people, they don't have a smartphone.
It's everybody, to be honest. And actually, we target at first the ones with the smartphone, because then they can give the room to the few ones that do not have to be able to go to the doctor. And I think we also need to realize the payment system allows you to just make sure that the service to get proper health is taken care of, whether you go on site or online. So it's not only for non-educated people, it's for anyone. Because a Cameroonian person living in Cameroon can support a cousin living in a village or in the city but not having enough money for him to go physically to a doctor or to use his handheld to do it. So it will touch almost everybody. It's not a full service. You don't have to go through this full cycle. You can use one or the other in order to serve the purpose of getting proper